Diabetes is one of the most common chronic diseases worldwide, affecting millions of people. This condition is related to how the body uses glucose, which is the primary source of energy for cells. For normal functioning, the body requires insulin, a hormone that helps glucose from food enter the cells where it's used to produce energy. In diabetes, this system is disrupted, leading to elevated blood sugar levels. If this condition isn't managed, it can cause serious complications and affect various systems of the body. There are several types of diabetes, each developing for different reasons and requiring specific treatment approaches. The most common types are type 1 and type 2 diabetes. Type 1 diabetes is often referred to as juvenile or insulin-dependent diabetes. This type occurs when the immune system mistakenly attacks the pancreas cells that produce insulin. As a result, the body loses its ability to produce insulin, and a person must receive it externally through injections or other methods. Type 1 diabetes typically develops in children and adolescents, although it can appear later in life. Type 2 diabetes, on the other hand, is more common in adults and is associated with the body either not producing enough insulin or the cells becoming resistant to insulin. This means that glucose cannot enter the cells and remains in the bloodstream, causing high blood sugar levels. Type 2 diabetes usually develops gradually and can go unnoticed for a long time. This type of diabetes is often related to lifestyle factors such as poor diet, lack of physical activity, and excess weight. Gestational diabetes is a form of diabetes that develops during pregnancy. Although this condition often resolves after childbirth, women who have had gestational diabetes are at a higher risk of developing type 2 diabetes later in life. Diabetes can occur due to various factors, including genetic predisposition, environmental triggers, and lifestyle habits. One of the key risk factors is being overweight or obese, especially if excess fat is stored around the abdomen. Lifestyle-related factors, such as lack of physical activity, poor diet, and chronic stress, also play a significant role in the development of diabetes. Some people have a genetic predisposition to diabetes, making them more vulnerable to the disease. However, even for those with a genetic risk, the condition may not develop if they maintain a healthy lifestyle. One of the most important aspects of diabetes is early detection of its symptoms. The symptoms of diabetes can range from mild and unnoticeable to quite pronounced. Here are some of the main signs that may indicate the presence of this condition. One of the first signs of diabetes is constant thirst and frequent urination. This happens because excess sugar in the blood causes the kidneys to work harder to filter and remove it. As a result, the body loses more fluid, leading to dehydration and consequently increased thirst. Another important symptom is persistent fatigue and weakness. Even though blood sugar levels are high, the body's cells cannot use the glucose for energy. This leads to a constant feeling of tiredness and weakness. Unexplained weight loss can also be a sign of diabetes, especially type 1. Since the body is unable to use glucose for energy, it starts breaking down fat and muscle tissue, leading to weight loss. Skin problems such as dryness and itching can also be symptoms of diabetes. High blood sugar levels can affect the function of sweat glands and reduce blood circulation, which leads to dry skin. Additionally, slow healing wounds and frequent infections are another sign of diabetes. Since high blood sugar can weaken the immune system, the body becomes less capable of fighting infections and the wound healing process slows down. Another symptom is blurred vision. Elevated blood sugar levels can change the shape of the lens in the eye, causing temporary vision problems. If diabetes is not controlled, it can lead to more serious eye issues, including diabetic retinopathy, which can result in vision loss. How is diabetes treated? The treatment of diabetes depends on the type and stage of the disease. Type 1 diabetes requires constant monitoring of blood sugar levels and insulin injections. A key part of managing this condition is maintaining a healthy diet and regular physical activity. Although insulin cannot be entirely eliminated in type 1 diabetes, proper diet and regular exercise can improve blood sugar control and reduce the risk of complications. For type 2 diabetes, the primary goal of treatment is to improve the body's sensitivity to insulin and lower blood sugar levels. In many cases, the first steps involve dietary changes and increased physical activity. Regular exercise can improve the body's insulin sensitivity, allowing glucose to be used more effectively. A balanced diet that includes foods with a low glycemic index also helps to control blood sugar levels. In some cases, medication is required to manage type 2 diabetes. These medications help control blood sugar levels. In more severe cases, insulin injections or other treatments may be necessary. How can you prevent diabetes if you have symptoms or are at risk? One of the main ways to prevent diabetes is by making lifestyle changes. Monitoring your weight is crucial. Excess weight is one of the main risk factors for developing type 2 diabetes. Even a small amount of weight loss can significantly reduce the risk of developing the disease. It's also important to modify your diet. Reducing the intake of sugar and simple carbohydrates, which quickly raise blood sugar levels, is essential. Instead, focus on foods with a low glycemic index, such as vegetables, whole grains, and lean protein. A healthy diet helps maintain normal blood sugar levels and reduces the risk of developing diabetes. Physical activity plays a key role in diabetes prevention. Regular exercise improves insulin sensitivity and helps maintain a healthy weight. Even moderate physical activity, such as walking, can significantly reduce the risk of developing diabetes. Managing stress is also crucial for diabetes prevention. Chronic stress can increase cortisol levels and interfere with insulin function, leading to elevated blood sugar levels. Stress management techniques such as meditation, yoga, or simply getting enough rest can help prevent the development of diabetes. Regular medical checkups and monitoring blood sugar levels are essential, especially if you're at risk. Early detection of prediabetes, a condition where blood sugar levels are higher than normal but not yet at diabetic levels, allows for early intervention and prevention of the disease. Diabetes is a serious condition that requires constant attention and control. However, proper treatment and lifestyle changes can help effectively manage blood sugar levels and significantly reduce the risk of complications. Early diagnosis and prevention are key factors in managing diabetes successfully. Thank you for reading until the end. I invite you to subscribe to my private Telegram channel where all the exclusive videos on health and longevity are collected. The link is in the description.